Good morning, everyone, and welcome back to IN-4-AHA monthly events. And this is the last event or the last workshop of IN-4-AHA project, as IN-4-AHA project will finish in 31 of December of this year. So my name is Elisio Costa. I'm from University of Porto, and University of Porto is part of IN-4-AHA consortium. The objective of today's workshop is to discuss the achievements and future ventures of the networks in the active and healthy living field. Furthermore, we will discuss during this workshop how these networks can work together to promote synergies and create critical mass in a coalition way. Today, we have with us representatives of major networks with interest on active and healthy aging, on active and healthy living field. So we have with us Maddalena Illario that will share the moderation of this workshop with me. We have Michele Calabrò from EUREGHA. We have also John Farrell from the Reference Site Collaborative Network. We have Karolina Mackiewicz from ECHAlliance. We have also Carina Dantas and Wilika Stradunin. I hope I pronounced at least in enough way, from SHAFE and Net for Age Friendly. And also, and finally, Marc Lange from EHTEL. As usually, this event will be recorded and then shared in our usual social media channels. Furthermore, if you have signed up via Fienta, you will receive our follow-up package that includes recording, notes, and the presentations. This is an open discussion, so feel free to drop your question anytime in the chat box, and in the end of the session we will have time dedicated to question and answers. So with no further ado, Maddalena, the floor is yours.
Thank you so much, Elisio, and it's a privilege for me to share this session with so many friends. We have been working together for a long time, and this idea of active and healthy living is, I think, the result of the efforts we have been developing since 2013, and it is somehow addressing the major events that have been driving forward the need to change from a reactive approach to disease management to a proactive approach to health that is person-centered and is focused on anticipatory proactive approach, anticipatory care. We know that we have been learning also that the information, sharing information and the time it takes to share information is critical when we face major challenges and events like the pandemic. And the capacity of the network to create the necessary background that we need to share in order to collaborate promptly to increase the resilience of our health system is very important. So as network, what we can do is foster the sharing vision and activities that are very important in case of needs. So EUROL is a European-wide coalition that brings together all these networks that contribute actively to promote active and healthy living, and this is pivotal to drive forward a more sustainable and people-centered system with a life course approach to health and well-being. And this is what we would like to achieve together. So I think that we are with these networks, we are an open community that can welcome any other network of stakeholders that is like-minded, that is willing to contribute to our shared goals. Back to you, Elisio. Cannot hear you.
Yes. Now we will start with the presentations of these networks that are at certain point interested and enrolled in the active and healthy living field. And we start with EUREGHA, with Michele Calabrò, that is the director of EUREGHA. So Michele, the floor is yours.
Thanks a lot, Elisio and Maddalena, for the excellent introduction. I think you said it all on the need of collaboration. And of course, as EUREGHA, we're also very happy to be part of this group of friends, indeed, working towards active and healthy living. And on top of it, of course, we are also ourselves part of the IN-4-AHA project. But if we can go indeed to the quick slide that I prepared, basically EUREGHA, if you don't know about the organization, it stands for European Regional and Local Health Authorities Network. So we are a European network based in Brussels that brings together local and regional health authorities to improve health policies in Europe. So the focus that we have is not exclusively on active and healthy aging, active and healthy living. We touch many other topics such as cancer, digital transformation, cross-border healthcare, of course, and we do it together with 19 members, currently 17 regions from across Europe, different countries represented from Italy, Spain, Sweden, Norway as well, the UK. And we do it, of course, to a series of engagement that are common actually to most European networks. We do it to working groups, and of course, we do it to active engagement in the EU health policy arena. In terms of work that we do, also it's very important to highlight that we currently are running 5 European projects that cover topics such as health workforce, mental health, digital transformation as well, innovation procurement, and of course we are part of the IN-4-AHA project. The IN-4-AHA project, it's quite important for us, especially because we are basically leading the work on stakeholder engagement and policy. And in particular, basically, one of our main activity recently is the work on the IN-4-AHA policy recommendations, where we've actually been in touch with several colleagues within IN-4-AHA and learned from the project work on the topic to come up with 7 recommendations that will actually be published in the next week. So I would say stay tuned. And just to give you a sneak peek on basically the focus of such recommendation, they will cover boosting smarter and accessible funding to innovation in the field, harmonized regulatory reimbursement framework for active energy innovation, streamline information about funding, reimbursement regulation, unlock the power of data, support the innovation development, participatory design in real life environments, invest in digital skills, and ultimately, and that's why we're very interested in this conversation today, better connect the network that are working in the field of active and healthy living, which is very important with us. And indeed, as I said, we're very happy to be part of this group of friends doing this. And that was all from my side, Elisio.
Thanks. Maddalena?
Yes? No, there is John Farrell. John, are you connected?
Yes, indeed, Maddalena. And good morning, everyone. And to everybody that's joined this morning, a big welcome as well. I suppose whenever I start to introduce the Reference Site Collaborative Network, and I apologize for any reference sites that are online at the minute who actually know this, but if I'll sort of beg your indulgence for a few minutes for the benefit of maybe those that aren't so clear on the Reference Site Collaborative Network. I think it's fair to say at the outset that our DNA is actually embedded within the European Innovation Partnership on Active and Healthy Aging, which was the initiative that the Commission launched in 2012-13. We are the only entity that has actually been created through the European Innovation Partnership on Active and Healthy Aging. And whilst many of the other network organizations out there have an interest in the field of active and healthy aging, we've been there from the outset of it. And where it actually came from back in 2013 was a bottom-up initiative from some of the initial active and healthy aging reference sites. You actually saw the benefits in coming together to collaborate and to share knowledge. And from that, and from the early beginnings in 2013, we have come through now to 2022 and the new dispensation going forward in the post-EIP-on-AHA era. We have currently 65 accredited active and healthy aging reference sites. And I think it's important to actually mention that all our reference site regions are accredited. They had to demonstrate that they actually were implementing a life course approach to active and healthy aging. And they also have to meet specific criteria and to actually gauge them in terms of their relationships they've struck up with other regions in Europe, the policies, the strategies that they have in place in order to deliver health and care, and also to demonstrate evidence-based good practices that have been scaled up within the region and are eligible to be transferred to other regions. So very much we're a stakeholder-driven initiative, and we're very much about fostering innovation in the local stakeholder coalitions. Looking towards our aims as an organization, it very much, because it is bottom up, it's led by the reference sites and it's for the benefit of the reference sites. It's all about supporting the reference sites in Europe and beyond, and I'll come back to the beyond bit about it, to promote all of the actions within active and healthy aging, or if we want to talk about active and healthy living. And it's about taking that whole life course approach. One of the issues at the outset with the EIP-on-AHA is that it very much focused on towards the end point of the person's life cycle is what can we do for this aging population? How can we extend their active life years? But the evolution and the thinking that came together from all the reference sites and from indeed the EIP-on-AHA action groups was that we needed to actually look at our health promotion strategies and our disease prevention, because it's important to look across that whole cycle of the person and their well-being from when they're born until they actually leave this world. And we need to identify, where are the big disease areas, how do we address those, and how do we move it all forward in the future. We also sort of support them by accelerating the deployment of their innovations that will improve health, well-being, and the care outcomes. And here we're supporting them in identifying the evidence bases, also in looking at their ability to scale up, whether it is regionally, whether it is nationally, or whether it is internationally, the different innovations and digital technology solutions. Also sort of looking at the development of new business models for innovative services. How do we actually approach innovation within the regions? How do we ensure we bring together the right stakeholders in that process? How do we provide the right test environments? And how do we actually implement the change? And what does that mean for the existing organizational and financial structures and for future organizational and financial structures? Through all of this, we try to facilitate the opportunities where the demand side, i.e. the health and care providers, can work with the supply side, the universities, the research institutions, the SMEs, in order to develop these new products and these new solutions. And through that, can it lead to opportunities for economic growth and jobs within the region through accessing other markets across Europe? As I said at the outset, we've got 65 accredited reference sites, and they're spread across 20 countries, 64 within Europe. But importantly as well, we have actually got one reference site, an accredited reference site in South Africa. And we are currently working with other countries in Africa in order to extend the principles and the learning from what started out as EIP-on-AHA to them as well, so that they can develop accredited reference sites and thereby we start to have that wider global knowledge sharing and exchange and collaboration going on. So that sort of is a brief background to the RSCN, and I hand back now to Elisio and Maddalena.
Thanks, Maddalena. Thanks, John. Sorry, Maddalena. Can you
Yes,
present Karolina?
I'm pleased to introduce Karolina Mackiewicz from the European Connected EHTEL, that is, she's the innovation director, and it's a pleasure to have been collaborating with the ECHAlliance so far.
Yes, perfect. Thank you so much, Maddalena, for this introduction, and good morning, everyone. It's my pleasure to present to you the activities of the ECHAlliance, or European Connected Health Alliance. I'm sure that some of you know about us, or maybe are the members, or maybe you run one of our ecosystems, but also, as John said, for those who don't know us, a short introduction. So we are the global connector for digital health. This means that we are trying to connect all stakeholders relevant, interested for digital health, from the development side, business side, implementation side, procurement side, and so on and so forth. And of course, with the patients and the citizens in the center. I'm sure that you all experience this in your life, of course, that you, or in your working life, that you realize that people who should work together don't know about each other's existence. So this is what ECHAlliance is doing. We are, well, connecting people and breaking the silos for better development and implementation uptake of digital health solutions. And our work is wider than active and healthy aging. So our topics are as wide as digital health. But of course, active and healthy aging is also one part of this that is also realized through our ecosystems. Many of our members, organizations work on this, and also our thematic innovation ecosystem. So let me tell you a bit more about those who are our members, who are our ecosystems, what this all means. So we have currently almost 1,000 member organizations from around the globe, mainly from Europe, but not only. And we have the members coming from public and private sector, startups, smaller, bigger companies, local, regional, national authorities, academia, and of course also patient organizations and other NGOs. So something that we know, of course, as the whole of society approach, or quadruple helix, is represented. Our members represent that. We also connect together the so-called digital ecosystems. They're often regional or on the city or on the country level, but mainly regional. So there are the gatherings or the permanent representation of the stakeholders working together for digital health. They're often hosted by the innovation agency in the region, or the University of Appliance, or other body that is interested to carry on this carry on this leadership role in digital health in the region or in the country. And yeah, we bring together the experts in digital health, and one of our like recent developments, although it's already 1.5 years, are the thematic innovation ecosystem. So there are the virtual gatherings of experts interested in the topics, in the specific topics related to the digital health, and for example, healthy housing, or also active aging, or some of those topics. And you might also know us, ECHAlliance, from something called Global Health Connector Partnership, which is global partnership for digital health, or the Digital Health Society, which is our data arm, or the Digital Health Observatory, which is our knowledge arm. So if you encounter us, then this is us. This is ECHAlliance Group. Thank you so much.
Thanks a lot, Karolina. Now we have the presentation of the SHAFE and Net for Age-Friendly Networks. I think we will be Willeke that will present. Willeke, the floor is yours.
Thank you. I'm also speaking on behalf of Carina Dantas, who could not be here or maybe join later. The smart, healthy, age-friendly environments networks are really happy to join the initiative of the EUREGHA, the active and healthy living approaches. The smart, healthy, age-friendly environment aims to combine and find the best solutions to combine ICT built environments, including the people's voice and references. From that, we have a we have a network of about 500 members that are individual researchers from the quadruple helix, representing citizens, businesses, public authorities, and the scientific community. And the people are represented from 51 countries at the moment. The network started, the Net for Age Friendly started in 2020 and will last until the end of 2024. Our aim is to bring together all the partners to enable the participation of everyone, single citizen in society, and to create inclusive environments for all generations. Our main deliverable of the Net for Age Friendly will be a reference framework in which we provide guidelines and standards and good practices also for active and healthy living. So that is also for refined. So this is the connection to the EUREGHA initiative. We also have a SHAFE Foundation so that we can also start with developing further projects and developments whenever the cost action ends, and this is to bring together. If you check on the www.shafe.eu, then you can also find the documents that are ground for this for the Smart, Healthy, Age-Friendly Environments Network. I think I have said everything, so I would like to give the floor back to Elisio and Maddalena. Thank you.
Thank you so much, Willeke, and I have the privilege to introduce Marc Lange, who has been a reference for us in the field of health telematics and with this broad community. Marc, the floor is yours.
Thank you, Maddalena. Thank you, Elisio. So in a nutshell, next slide, please. In a nutshell, EHTEL, and as you can see, very little text, and I will try to be very synthetic here. EHTEL is a collaboration platform for digital health in Europe. We exist since 23 years, so we have quite a long history on all the mistakes and all the successes and trials that have been running over the years on this field in Europe. Really, what are we doing for our members and for the community at large? What are we doing is accompanying them in their digital transformation, accompanying organization in their digital transformation in the field of health and care. And the key element, a key contribution of our support, of our assistance, is to bring around the same table all those groups which are involved, which are important for the digital transformation. So the public authorities, payers, and other regulators, but also, of course, the users, being health professionals and citizens and patient organizations, being also the industry, because they are technology provider or they are service providers, and of course also the innovations, the innovators, because in the end, what we do, and that's really also an important point, what we do is that when accompanying our members and other organizations in their transformation, we work on this. We work with them with a long-term perspective, with a short-term and a medium-term, and a long-term perspective. So that's where innovation comes into play. And of course, while we were not part of IN-4-AHA, we are working also in a lot of projects over this year. We were involved in not less than 10 different EU-funded projects dedicated to innovation. So very intense in that work. Now, in terms of positioning our work in the context of this active and healthy aging, what is really important here to say is the fact that we have today two main priorities, two main topics on which we want to work. one type of work stream is data centered, and then we deal with very much with European health data space. But the other part, and that's the most relevant part for this environment, the other part is really everything that is about person-centered care. And of course, issues like integrated care, issues like digital health literacy are important to us. And in fact, we are very much using the term of hybrid models of care, where we have process models of care which are combining in-person encounter and digital solutions. So this mix of things, that's really the work stream we are working on. And I think that with this, I have said all what matters for the moment. Thank you.
Thanks a lot, Marc. And next, what we have thinking is to put one question or two questions in this case to all of the participants. And after that, we will open the floor to all of the attendants that can put also questions. So, and our first question is about what are your organization future plans in the field of active and healthy living. So let's try to move with the same sequence of speakers: Michele, John, Karolina, Willeke, and Marc. So please, can you, Michele, can you start?
Yes, of course. Thanks a lot. Thanks a lot, Elisio. I'll be very brief because I think one answer directly to that, it's as was already mentioned by several colleagues, is to keep working together towards the zero coalition. I think that's one really important thing for us as EUREGHA. We've been, extremely honored to starting this work in the past few months, and we want to keep going forward with this. So this is one part of the answer. The second part of the answer is, of course, we are, as Elisio, you rightfully mentioned, we are going towards the end of the IN-4-AHA project. So we are incredibly busy with the finalization of the final conference for the event, which is going to take place on 7 December in Tallinn and virtual. And after that, that's also going to be a starting point for what's going to come next again for us. As I said, we have the policy recommendations, so we'll take stock on that and use them to work, with the colleagues around the table and with our members and with external stakeholders to promote these learnings and eventually, to keep further discussing what's needed to ensure that active and healthy living it stays high in the agenda, and innovation within it also stays high as well. So that's in a nutshell a little bit what's next for us at EUREGHA.
Thanks, Michele. So now, John.
Indeed, Elisio, thanks very much. I think whenever I look at it, one of the things that I'm very mindful of, and indeed within the RSCN, we're actually mindful of, is that the change actually happens within the regions. It's actually the regions that are really making a fundamental difference in what active and healthy living or active and healthy aging. And I think as a network, and in recognizing that, it's important that the benefits that are actually being delivered by the reference sites, we actually try to look for opportunities so as to extend that more broadly across Europe and globally as well. And also within that, to support the different active and healthy aging reference sites that are out there so that they can continue to make change and transform the health and care systems and deliver improved outcomes for all their citizens, and particularly those within that life course approach to active and healthy aging. Within that, going forward, we will look to continue the fourth call that we had for the active and healthy aging reference sites. We're going to leave that as an open call, and that facilitates us actually bringing in the countries from Africa that I referred to earlier, but also looking to extend to the other regions in Europe as well. So we will have a lot of promotion that we will actually do in order to bring that about. Then whenever we sort of look at how do we actually go about supporting the different active and healthy aging reference sites, there's a number of things that we have in mind whereby we can do that, but also at the same time starting to influence the regional, the national and the European agenda as well within the field of active and healthy aging. And some of the things that we're going to do within all of that, we're planning to do, is that we have a number of thematic actions and thematic working groups. So we're going to recommission those, but recommission them following the fourth call and the different challenges that have been identified within the fourth call going forward. So where these thematic working groups, what exactly they are, very much they bring together the different experts from across the quadruple helix model. And I think every one of the presenters this morning has referred to the quadruple helix model in some way or other, bring together all those coalition stakeholders within the regions. What we want the thematic working groups to do is to identify those research gaps that need to be addressed collaboratively, so as we can maximize the impact of the research findings that are coming out in that whole life course approach to active and healthy aging. We want to sort of use the thematic working groups as well, so as to be able to assess and evaluate the different good practices that are coming out, not just those that were presented as part of the evidence for the fourth call, but also evolving and new good practices that are starting to emerge within and across regions as well. We also want to support regions in terms of how they go about adapting or adopting innovation, learning from other regions, and what does that mean to transfer that to a different region or to a different country. So there's an opportunity there to support all of that. And that's about trying to get the maximum impact to the maximum number of people from a successful innovation that has been developed. We also want to continue to spread the whole knowledge, particularly that knowledge that starts to emerge from different European funded projects, whether those are projects the RSCN is involved with or not. We want to be able to gather that information, we want to be able to disseminate that and improve the learning and understanding across all of the regions going forward. We have also plans to publish case studies that are addressing the life course approach to active and healthy aging. And we will start that process with those good practices that have been identified from the fourth call, but we will look to build on that, and we will make that available to all the regions across Europe and elsewhere, so that they can benefit from the learning and the experiences from that. In terms of keeping our people informed, we will continue our programs of webinars and different events in terms of making that learning happen. And importantly, in the past, we have contributed to such areas that the Commission has brought forward, like the European Partnership on the Transformation of Health and Care Services, like the Green Paper on Demographic Change. We will continue to contribute to those key strategic documents and strategic initiatives of Europe to ensure that a life course approach to active and healthy aging is represented within the thinking of that, but also that the recommendations that flow from such strategic initiatives and documents actually take account of and provide opportunities for the work that is going on within regions across Europe in this area. So that's where our plans are in terms of the future going forward.
Great plans, John. So now is Karolina. Karolina.
Thank you so much. Well, maybe not so extensive from the ECHAlliance side, but of course, like also a couple of points that I would like to share with you. Well, first of all, we are not members on IN-4-AHA, but I'm the part of the advisory board, and I'm also excited to join the project final conference in Tallinn. So I'm looking forward to learn more about the results of the project and also how they can be exploited within our network, also blended with the results of the other projects that we had on the similar topics in the past. Currently, we actually don't have any open projects or running projects on this topic, but it has been one of the strategic teams of the ECHAlliance, of course, and well, so it would be great to really see how this can be used, and what can we do with that? So of course, then the other part is that yes, we're a member of the coalition of the EURAL. So looking forward to work together in 2023 and beyond on that. And then maybe also something very practical. I mentioned our thematic innovation ecosystems as those need-driven virtual gatherings. So we will definitely then, based on the result of IN-4-AHA and other current and relevant development in the topic of active and healthy aging, also bring those issues to the thematic innovation ecosystems, as I mentioned, for example, skills for health or healthy housing, well, digital health and well-being. Of course, the active and healthy aging can be the topic on its own, like drive the thematic innovation ecosystem, or can be one of the topics because it's very relevant for other issues in digital health. So this is shortly from me. Thank you.
Thanks, Karolina. Now, Willeke.
Yes, thank you very much. As we are aiming to achieve more smart, eco-friendly and inclusive environments for all generations, we mainly focus on the implementation and coordination question. And in the cost action, we will focus on the development of bringing together all the knowledge about user-friendly design, the integrated care and well-being, digital solutions, and how to upscale. It's also focusing on the funding opportunities to realize smart, healthy, age-friendly environments, and also on the impact that it generates. This will all be brought together in a reference framework with guidelines, standards, and good practices, so that everyone, every individual or every organization can work for it to implement the active and healthy living aims. For the SHAFE Foundation, we are seeking for to realize to provide funding to realize small-scale projects as soon as we can work on that for the future. But that is not realized yet, so that is has to wait. I think that is the main contribution to the active and healthy living movement. Thanks.
Thanks, Willeke. Now, and finally, for this question is Marc. Marc,
thank you, Elisio. Well, in a nutshell, and without going too much into details, because we will have a general assembly of members in 3 weeks' time, so when we will discuss our work program, but at least I can give some orientation. First of all, our future plan are first next week, where we have our symposium, virtual symposium running next week, and you will find here the URL. It's still possible to register at no cost, of course. The focus is on European health data space, but 2 sessions are very much person-centric in this context. One on Monday, which will be dedicated to organizing citizens' access to data, to their own health data, which in fact is a reference to the Article 3 of the proposal of the European Commission for European health data space. So 1 session on this, and then on the day after will be another 1 session. Interesting to know that it's always the first session of the day. So the second one on Tuesday will be dedicated to a broader picture on creating what is needed to create a data culture for the society, again, for sharing data. So it's a mix between our work stream on data-centered work and on citizen-centric. So that's the first activity, the first element. The second element, certainly, that we will be that I would like to refer to is this advocacy campaign that we have started about a year ago, that we will continue, which is dedicated to citizen-centric data sharing. So we still continuation of what I'm referring to in the symposium. So that campaign, we will continue to further work on this. So citizen-centric data sharing is an approach for data sharing that is complementary to the classical clinical-centric or clinician-centric data sharing make a system. So second or third element of our third priority or third not priority, third topics we'll be working on is on what is everything that is about patient or citizen-facing apps, citizen-facing technology. So here, typically the mHealth technology, since we will be working with our friends from IHT on maintaining activities on the mHealth Hub that was initiated 3 years ago, and further developing the mHealth Hub. So again, very much citizen-centric activity. Then we will also work and start to work with our friends from ECHAlliance and some others on upscaling, so on large-scale deployment of digital services here. And again, it's with the objective to help all those who are in the process of their digital transformation, to help them making digital services part of the real life of more and more people. That's another activity. And then last but not least, we will also continue along the same line to facilitate synergies between projects, which is what is called large-scale projects, who are developing digital services. And again, with this same perspective of creating collaboration, developing synergies, and all is in the view of helping to exploiting the project results and helping to exploit to further deploy digital services to the benefit of citizens, of patients, and of course on society at large. So quite a long menu actually.
Thanks, Marc. Let's go to the next question. And Maddalena.
Yes. So now we have heard so many efforts from any of the networks in driving forward a number of initiatives. But now the question becomes, what benefits do you see in participating to this coalition for your organization and for your networks? And also, how do you think your organization can contribute to drive forward a shared initiative in active and healthy living? How can we do it together? So let's start with Michele.
Thanks a lot, Maddalena. I'll be extremely brief. I think the benefits they come together with just what everybody presented. Many of us are also like in different projects already connected together. So doing it in a little bit more structured way to the coalition, it just adds a better organization behind it. So that's absolutely great. And indeed, the collaboration has been wonderful so far. So we're looking forward to that. The second part, it's what we can bring in. I mean, indeed, we also work as the reference sites network and on many other colleagues also with regions. And as was mentioned as well, the change often happen and it's taken forward by regions. So we'll have together with the other colleagues that are looking into this to bring forward a perspective as well, and to connect, of course, as much as possible with the work that we did in general, also with the IN-4-AHA colleagues. So that's my point there.
Thank you so much, Michele. And now we will move to John Farrell. John.
Thanks very much, Maddalena. There is no doubt that there are a lot of benefits from different networks coming together where there is a shared objective within all of that. And clearly active and healthy living, or a life course approach to active and healthy aging, or even another term that I've heard, which I think is equally applicable, is population health, provides that sort of focus for people on the organizations to come together. I think we do need to have a shared understanding of what is meant by, whether it's called active and healthy living or population health or a life course approach to active and healthy aging. I think we need to have that shared understanding amongst ourselves for that, because that then provides the opportunities where we can actually look to identify what each of us as networks are contributing into that. But importantly, it is to identify where the gaps are. how the networks are, what are the opportunities for the networks, either individually or collectively, to come together to address those gaps. I think whenever we sort of look at how we sort of take it forward and all of that, you know, there is no doubt that, you know, each of us here today, each of the networks here today, and other networks that aren't present today, we do have already well established either structured or unstructured relationships with each other. We are doing things collectively on shared webinars at the minute. We're working together in projects, but we also do reach out to each other as well. So I think there is something about bringing that into a common space or a common area that provides that sort of a safe environment for us all to come together. But I think when we look at it, it has to be something that's voluntary. It can't be rigid. There needs to be flexibility within it. We can't duplicate, replicate, or try to create, recreate what already is being delivered by any of the existing networks that are there. And I think that will be the sort of challenge, is having that recognition and that shared trust amongst all the members within it, that the focus is on that, whatever term we call for it, and that we do recognize the strengths of each of the networks within that. We build on those strengths, we identify the gaps, and collectively we then sort of take those forward. I think the last thing we would want to do is to do something that ends up confusing the audience that's out there as regards, you know, we've used the term URL, you know, the coalition URL. You know, does URL supersede any of our individual organizations? I don't think it can, because we all have different remits and we all have our own target audience as well that we support and work with. So that's it in terms of going forward. But I sort of say we need to do a bit of thinking in terms of how we come together to provide that flexibility and that voluntary approach, and do look for the opportunities for collaboration amongst each other.
Thank you so much, John. The floor to Karolina, please.
Thank you so much. So, well, the mission of the ECHAlliance is to connect the dots. This is what we say. So, of course, I think that connecting the networks, this is something that it needed to be done. And why? Of course, to also avoid fragmentation. And we speak a lot about the fragmentation of data, the fragmentation of effort, and of course, if we don't collaborate in this area of active and healthy living or other areas, and we see how many things are being done, then I'm afraid that we get into those silos and we are just competing for very scarce resources and also attention of the stakeholders. We see it all the time that we are actually addressing the similar people. So why not to do it together in a bit concerted action with better impact, and also from this, like moving from this intention that we really would like to do something good to really to impact. And I think like we are also speaking a lot, of course, about shifting paradigms in healthcare, in use of resources, in thinking about how we are actually managing different processes in this world that is changing. And I think that this is also part of that, to actually like bring together all this work and work for one goal after all, which is, I believe, scale up and uptake. We know that, of course, many of the solutions are like staying in the, as startups or are dying or are used only in one region, one city. And this, of course, also prevents the scale up and uptake, and again, contributes to this fragmentation. And just small, anecdote or story. I spent this week at the WHO Euro at the WHO Healthy Cities annual conference. And this is the network I was connected before the European Connected Health Alliance. And I was speaking with many of the representatives of the cities about that come usually from health and care sector. I was speaking with them about the digital health, and they know what's going in their city or region in regard digital health. And it turns out that those groups don't know about each other very often. because digital health is often with the innovators, with those people that do some things with, you know, data, IT, technology, and health is with the health and social care. And I think that we should definitely work to bring those words together, because if we have the digital health action plan in the European region and all the different policies in regard to data and digital technologies, then we definitely need to work together. Thank you.
Thank you so much, Karolina. The more I listen, the more I learn. We need to build upon our synergies. So I would like to give the floor now to EUREGHA, please.
Thank you very much, Maddalena. Yeah, already much has been said, so I cannot, I won't annoy everyone to repeat it. But I think it's very important to work together, because because we are very diverse networks, and we can learn from each other, because everyone has his own angle to look at the active and healthy living approach and what is needed for that. And I think we should benefit from that, all these different angles, such as data, health, digital, and what is all needed for active and healthy living. So I think that's the main benefits of bringing all these networks together. And that's it.
Thank you so much, EUREGHA. And last but not least, Marc.
Thank you, Maddalena. Actually, collaboration is part of our DNA, as you have seen from our first slides. So no doubt that this is important, and that we want to create, and we want to collaborate with others, and very happy to collaborate. But the question is on what? And that's really what is an activity or a group like EUREGHA and like this group. That's what it answers. Working on these aspects of being person-centered or being active and healthy living. So very happy to have here a collaboration on a particular topic that is still broad, but that's still very concrete in the same time. So no doubt that that's something that we want, as EHTEL, we want to do. And also certainly, we are well aware that, well, everyone within the group has its own network, and everyone is working in a different way. Diversity is the rule also in the way we work, and that's where the collaboration and the development of synergies is delivering values, is that through different angles we can come to the same point, we can come to the same results, and we can have an impact. So no doubt that for us, collaboration is a means to an end to have an impact and to benefit from the diversity that exists everywhere in the world. Thank you.
Thank you so much. First to you, Elisio.
Yeah, thanks a lot for the response that you all gave. So now we are in the line of our time, but I will give floor for 1 or 2 questions coming from the ones that are attending this meeting. So please, who wants to put some question to our speakers? No, there is no questions.
There was sorry, Marc. There was a point raised in the chat box, Elisio, from Giselle. I think it's a very important. Yeah, I think it's a very important point. So we do, you know, it's all right. You know, being very global is great, but contact with the local stakeholder regions needs to be kept real, fluent, and grounded. And I totally agree with that sentiment. There is no point on it, and I'm seeing the heads nodding from other colleagues on the round table as well. I think this is something that we would want to see going forward. We don't lose sight of what is happening, because as I mentioned earlier on, you know, the real transformation and change is happening in the regions. You know, we need to be doing things that support the regions and actually delivering on that.
Yeah, fully agree. And I was about to say exactly the same point with John. Thank you, Gisela, for having drawn the attention on this. Let's be, our work needs to be pragmatic, needs to be close to the field, and really helping those who are really doing things helping them to do things.
So we have here Lydia. She wants to put a question. Let's go.
Yes,
Lydia.
hi, thank you so much for today. It's been very insightful. I just have a question because a few of you talk a lot about, there's been a couple of you that spoke about implementation of these technologies and innovation. You know, ultimately that is the goal, that we collaborate, Karolina, and we bring all of these, you know, connect the dots together, and then that we're able to implement some of these new technologies within the healthcare system. Can you talk to me a little bit more about your direct efforts for better implementation?
I can start if you want.
Yeah.
I think that here I would like simply to refer to the project I was referring to, where we work with ECHAlliance, which is called Digital Health Uptake. And I will ask, yeah, the project has just started, so there is a URL, but the website is still empty. But Digital Health Uptake is really one of these projects that is intended to help local actors to deploy on large scale their digital health services. So there will be some work done through the project. And one of these activities will be about, and that's the one that we as EHTEL we will be leading, is about accelerating, so providing guidance, making available tools or methodologies that helps to organize the large-scale deployment of digital health services, and we will be working in this work package with Karolina and with John also. There will be some training activities like in Gatekeeper. There will be some other activities, again very close to the people to the doers, what we call the doers, those who are implementing.
Yeah,
And then what?
Oh,
Okay, everyone wants to. I can. Was it you, Vileka?
yes, it was me.
Go on.
Okay, okay. So yeah, but also to support the implementation of the realization of active and healthy living is also that we aim to develop the reference framework where we bring together all these tools and supports at local, that every single member can use to implement smart, healthy, age-friendly environments or active and healthy living environments in their own community or city or town, whatever.
And just maybe one word from the ECHAlliance perspective, of course, like within those ecosystems and thematic innovation ecosystems, we bring together, our aim is to bring together the people who need those solutions and those people who develop the solutions, the people who need to deploy or will pay for those solutions and will manage those solutions. So generally the whole value chain, and to make sure that those solutions that are being developed are actually responding to the needs, and then there is also a good system to reimburse or pay for them, and what is the word, implement them within the local or regional or national context. So,
yeah, just also from the RSCN viewpoint, the uptake, the implementation of the innovative solutions requires the implementation of a process. It's never the implementation of an isolated solution into an isolated organization or place. So the effort at the RSCN is to bring together the stakeholders at local level so that they can see the process and not to try to implement isolated solutions. This is the real added value, I believe, in building a local ecosystem, and sharing knowledge and tools with other participants at national and international level is a real added value. So this is what we can bring on the table.
Yeah, and if I can maybe just add to that, Maddalena, digital technology is an enabler. It's an enabler to change. It is going to have implications for the organization and the organization structures. So it's important to sort of look at what organizational changes are required in order to support the technology that's coming forward, or even before that, what organizational change is required in order to deliver the better outcomes, and then how do you fit technology within all of that, and then how do you make the technology work? Where's the evidence base for that? And then we can look to implement that and then scale it up.
Oh, great. So we still have here some comments in the chat. Diana, do you want to tell something or?
Elisio, there is a question from Sharika Siraki on environment and health. So that something from WILEC, I think, because I think that SHAFE is the only network that explicitly refers to the built environment. And
you're muted at the last sentence, Maddalena.
Yeah,
there is a question from Sharika Siraki on health and the built environment.
Yes. We include the big by bringing together the built environment and also the smart solutions, whatever is needed. And we've also shift more and more towards eco-friendly solutions. That is also part of the focus that we will have to also enable a sustainable future for all generations, because that's really needed. And so I fully agree with Charika regarding that. Thank you.
Yeah, we need to look for health, but in environmental way. So
absolutely,
is One Health movement that is growing across Europe. One Health. So Diane, do you want to tell us something, because you have here? Yeah.
I will simply add that next year, 2023, is going to be the European Year of Skills, and it would seem as though there's going to be a tremendous focus both on digital skills for people of all backgrounds and all ages, but also their green skills as well, their environmental skills. My question to you all was going to be around practicalities and around whether we were likely to see a mandate, a declaration, and then perhaps some collective activities going forward, perhaps in the course of 2023. What can we look forward to next?
I will give the floor to our speakers, Michele, Marc, Willeke, Karolina, John.
I can maybe try. Well, first of all, to link to what Diane was saying about digital and green skills being brought forward together. There's another project where several of us is also collaborating. So again, the collaboration is basically never ending already. It's really good to structure it further, and it's called Be Well Project. So keep an eye on that as well, on top of the other ones that we shared. Regarding the next step. Of course, this was also the beginning of, again, a continuous, let's say, conversation that we had since, I would say, April, May, with the colleagues around the table. We're still in the phase of defining exactly, the work plan for 2023. I think many starting point, as was mentioned already. It's really just to start to bring together what we are all doing within the different organization. Because that's the value, first of all, of the coalition, to avoid duplication, but actually to boost on what we're doing. We will see in terms of events and so on, because it's also a collaboration that is just starting, to develop. So we'll keep you posted. And I think, there are also information already on the EN4-AHA project, but we'll be very much happy to share information on how to stay connected, and eventually, if you're a European-wide network, also if you would like to jump on this collaboration as well.
Thank you so much.
Thank you, Michele. That's precisely the point. Mm-hmm. You are the boss.
Really not, but
okay. If there is no other question, I think we can close the session. We are already with 10 minutes of delay. So thanks a lot to all of you that attend, that speak, and I hope we have the chance of have a great collaboration in the upcoming years. So
thanks a lot.
Yes, thanks a lot, and looking forward to the future. Bye-bye.
Thanks a lot.
So much.
Thanks so much, everybody. Very interesting. Thank you.
Ciao.